Hi, I'm Aniela Amio, and I'm a Pilates teacher and a yoga instructor at the Orthopedic Therapy Clinic in downtown Toronto. And this video is for you if you're experiencing some pain or some tension in your neck when you're working on your core exercises on your back or your transverse abdominis exercises. So grab yourself some towels, some pillows, some things you can use to put under your head, and join me on your back. So you're on your back working on some of your core or transverse abdominis exercise, whether it's moving your legs, your arms, or both together, but you're here because you're experiencing some pain, discomfort, tension in your neck. First thing to know is that we want to talk about having a comfortable, relaxed position here. So if you have an injury and you need to speak to your treating therapist about that, that's one thing, but here we want you to find something that feels comfortable and relaxed for you. We're going to offer you some general guidelines. So when I'm laying down on my back, I want to check that my chin isn't poking up higher than my forehead and nose. You can see this kind of angled up position here, like chin forward, is usually not ideal. Where we want to be is with our chin, nose, eyes nice and level, eyes looking straight up at the ceiling. And this is more relaxed, more comfortable for most people, most humans in their neck. So if this is where you can be without having to force yourself here, be here. If you can't be here, you might want to try a small towel, a pillow underneath the back of your head and neck to find this for you. That means you might have a roll, might feel more comfortable. You might have a slight little towel. You might have a pillow and a towel or just a pillow, but you want to play around with different heights, even different positions. It's okay if it's a little further back. It's okay if it's a little further forward, but you want to feel what's right for you. This is the most important thing. Next thing here is while you're here, you want to make sure that you're breathing. When we hold our breath, some humans tend to tense grip through their neck, their jaw. So you want to make sure that you're breathing while you're doing your core exercises and that you're not tensing or creating more tension in your neck. And if you're not quite aware yet when you are creating that tension or gripping or squeezing, you might need to actually use your hands to touch around through your neck and see if you can feel that these muscles when you're doing nothing are relaxed. And then is there a difference when you start moving around your legs? So don't do something with your legs that's not appropriate for your body right now, but if you're moving your legs and doing any of your core variations, are these muscles tensing up? Can you consciously relax them? And that doesn't mean that you need to grip with your hands either. It's just a gentle noticing anywhere in your neck. Are things tensing and squeezing on you? So again, find something that feels comfortable for you. Maybe it means no pillow, maybe it means a pillow, towel, or something else you have around the house. Maybe it means that you just need to check in with your breathing or check with your hands. Now that you've found something that's relaxed, there's another thing that you might be able to do. We call them micro movements or little movements. So if it's relaxing for you to just gently move your head side to side, kind of like you're saying, yes, yes, no, no, it can be a tiny little movement here with your head. If that feels comfortable and relaxed for you, you can try doing your exercises, anything with your arms or legs, while you're doing that tiny micro movement. For some people, being able to move or mobilize your neck is not going to turn on that stabilizing, clenching, gripping for you. So see if that works for you. Lastly, what's going on with the effort level of your exercise? If I'm doing a core exercise and it's doing fine in my neck, but then I start working on a harder, heavier variation and my neck starts tensing, I might need to talk to my therapist about taking my program down just a notch, still targeting the same muscles, but doing what we call a regression or a modification. You can target the same muscle, doing more reps to still build up strength, but without your neck tensing up. That means that in time, once you teach your neck to relax and your core gets stronger, you can progress to that harder variation, and hopefully your neck at that point is going to come along without tensing or gripping. So again, find what feels comfortable for you. Props, no props in various different positions and heights. Check that you're still breathing while you're doing your exercise. Try using your hands to get comfortable feeling what is tension for you, what is not, and then maybe you can do that without your hands someday. You can try the little micro movements during or even before or in between your exercises to just reset. You know, you come down from doing your core exercises and you just reset every once in a while, give it a little wiggle, touch, take a few breaths, release that tension through your neck and jaw. And then lastly, check out the level of your core exercise. There's many variation modifications that we can do to target our transverse abdominis or core, and it's totally okay to talk to your therapist about finding one that's working for you where you are right now. You need to be able to advocate for yourself and communicate with your therapist what you're feeling so that you can get the best out of your program. Again, if you are having some pain and you need some help, please reach out to your treating therapist and they would be happy to help you.